All right. Good afternoon, everyone. It is, even though it is dark, it is 10 minutes after 5, so I can say good afternoon. Welcome to the 16th African World Earth Day. We are so glad to have you here. My name is Pastor Fukru Iticha. I'm from Sub-Saharan African Youth and Family Services. Sub-Saharan African Youth and Family Services, a non-profit community-based organization, has been working on HIV prevention, education, and various social services. Sub-Saharan African Youth and Family Service have been there for the last 2 decades and diligently serving the community. Today we are celebrating the 16th African World AIDS Day. We have been celebrating this World AIDS Day since 2004. African communities, various African communities come together and celebrate every year. But this time, because of the COVID-19 pandemic, we couldn't come together personally, sharing musics and sharing a lot of things together, not only celebrating that. It has been a lot of fun, but this time we couldn't do that. We are doing that virtually. We already celebrated the World AIDS Day on December 1st. I'm glad we sponsor that too. And then now Sub-Saharan African Youth and Family Service is very proud to sponsor this event. And then I would like to say welcome to everyone. I have 6 guests. Among those, I have a keynote speaker, Ms. Toabech Abaire. She has been living with HIV/AIDS for the last 2 decades. And then she's here to share her experience, especially she got a lot of experience, but she's gonna talk briefly on HIV stigma, the stigma she has faced in the last 20 years. So my other speaker is Dr. Osman Hamed from East African Health Project. Mr. Henry Momanyi from Global Health Service and from United Central Seventh-day Adventist Church. Mr. Samuel Teklaap from Ertra Community, from Ertra Community Radio Service. Mr. Abdullah Sheikh from African Community Service. Mr. Bahar Omar from Sub-Saharan African Youth and Family Service, from Eliminating Healthy Disparity Initiative program. Yeah, so we are celebrating African World AIDS Day today. We have a good reason to celebrate that. When we celebrate African World AIDS Day, we are remembering about 33 million people who lost their life in AIDS and the related diseases. We have lost globally, we have lost 33 million lives, and then we are celebrating their life with their family. Whenever we celebrate Africa World AIDS Day, we always remember those who lost their life in AIDS. The other thing is we are showing our support and the care and love to people who are living with HIV/AIDS. As of 2019, about 38 million people are living with HIV/AIDS. Among these, 68 to 70% are living in Sub-Saharan Africa. So whenever we talk about HIV/AIDS, we are talking mostly about Sub-Saharan. I'm not ignoring the others, but most of the people who are living with and suffering with HIV/AIDS is living in Sub-Saharan. Out of 38 million, about 25.7 of them are in Sub-Saharan at this time. So to manage our time, I will go to my first presenter. My first presenter is going to be in Afaan Oromo. First of all, before I just invite Mr. Bahar Omar to present his presentation in Afar Oromo, I would like to thank those who are watching us live on our Facebook. You can find us live at Sub-Saharan African Youth and the Family Services Facebook page. So I respectfully ask you to share so that the others can benefit from it. And I will go to Mr. Bahar Omar from Sub-Saharan African Youth and the Family Service. He will present his presentation for the next 5 minutes. It is yours, Mr. Bahar.
Thank you, Mr. Fikro. Thank you, everybody, for joining us, and good evening. Yeah, my presentation is in Afan Oromo. Now I directly go to Afan Oromo presentations. Arra guyyaa qophiin kun kan qophaa'e ayyaana waggaa Afrikaa akka Afrikaa sadarkaa Afrikaatti kabajamu guyyaa HIV yookiin AIDS'ti. Mata dureen guyyaa kanaa Sub-Saharan African dhaabbanni sponsor godhee jiru fighting stigma yookaan loogummaa to'achuu ka jedhu. Loogiin HIV keessatti miidhaa garaagaraa fida. Isa kana tokkoffaa loogii jechuun maali? Lamaffaa loogiin kuni maddi isaa maali? Miidhaan inni hawaasarra gahu maali? Loogii kana immoo akkamitti irraa nu dandeenya ka jedhu gaggabaabsinee ilaallaa jechuudha. Tokkoffaan loogiin HIV irra gahu sababa loogiin AIDS kuni maali? Yoo jennu ilaalcha dogongoraa namoota HIV waliin jiraatan irratti qabu jechuudha. Namoonni kuni akka waan namoonni kuni badii isaaniitiin dhukkuba kanaan qabamanii akka waan uumaadhaan abaaramanitti hubachuun tokko dogongora hubannoota irraa kan ka'e namoota kanaaf ilaalcha addaa qabaachuun, ilaalcha badii, ilaalcha dogongoraa qabaachuun jireenya isaanii keessatti isaan rakkisuun loogii HIV AIDS yookaan AIDSdhaan wal qabatee jiru loogii tokko kanaa jechuudha. Loogiin kun akkuma beeknutti irra caalaa kan dhufu hubannoo dogongoraa dhukkuba kanaa, maalummaa dhukkuba kanaa, akkaataan dhukkubni kun itti daddarbu, akkasumas odeeffannoo gahaa dhabuu, hubannoo gahaa dhabuu irraa kan madde keessattuu yeroo dhukkubni kun dura mul'atu mallattooleen akka barsiisaatti kennaman sodaachisaa ta'uunsan dhukkuba kana namni akka shakku akka sodaatu nama dhukkuba kana wajjin jiraatullee namni akka shakku akka sodaatu godhee jira jechuudha. Kanaatu loogiin namoota HIV jiraatan kanarraa akka gahu godhe jechuudha. Loogiin kun maal faadha yoo jennu taate irra caalatti loogiin godhamu kun kan namoota dhukkuba kana wajjin jiraatan hamilee isaanii akkasumas saayikoolojii yookaan sammuu isaanii kan tuqu jechuudha. Namoonni kun akka hawaasa akka of tuffatan akka gartee ilaalcha negatiiv ofii qabaatan kan godhu akkasumas hawaasa keessaa akka of moggeessan akka kophatti of baasan kan isaan godhu. Kun immoo dhiibbaan inni qabu namoonni HIV wajjin jiraatan kun akka hawaasa keessatti dhokatan akka gad ba'anii hin barsiisne godhuudhaan namoonni biraatis akka hin baranne namoonni akka qoratamanii bu'aa dhiiga isaanii hin beekne godhuudhaan namoota dhukkuba kana wajjin jiraatan qofa osoo hin ta'in akkuma hawaasaatti irrattu to'annaa dhukkuba kana irratti godhamu irratti dhiibbaa mataasaa qaba jechuudha. Gama biraatiin loogii yookaan stigma kana akkamitti irra aannaa ka jedhu immoo hubannoo walii dabarsuun barbaachisaadha. Tokkoffaa waa'ee dhukkubaatis haa ta'u waa'ee namoota dhukkuba wajjin kana jiraatanii ifaan ifatti mari'achuu dubbachuudha jechuudha. Sadarkaan duraa ifaan ifatti akka hawaasaattis miidiyaa irrattis akkasumas carraa argame kamittuu waan dhukkuba kanaaf hubannoo babal'isu amaloota dhukkuba kanaa hubannoo babal'isu dhimma namoota HIV jiraatanii akkuma nama kaanii akka ta'e beekuu barbaachisaa. Hubannoo dogongoraa uumame san qajeelchuu barbaachisaa. Akkasumas tarkaanfilee garaagaraa fudhachuudhaan akka kun amma SFSM godhaa jiru kana hubannoo konferansii hubannoo cimsu gabbisuudhaan namoota dhukkuba kanaa wajjin jiraatan hawaasa affeeranii akka isaan mudannoo isaanii hawaasaa ibsan godhuudhaan stigma yookaan loogummaan kun haga tokko akka xiqqaatu godhuu danda'ama jechuudha. Kana waan ta'eef nu hundinuu gama keenyaan akka nama dhuunfaattis akka garee hawaasaattis akka baqattoota Afrikaas jiraatu kanattis kanarratti gahee mataa keenyaa bahuudhaan waa'ee dhukkuba kanaa gabeenuu hubannoo babal'isuudhaan dogongoraa jiru qajeelchuudhaan nutis jijjiirraa amalaa godhuudhaan namootni HIV wajjin jiraatan akkuma namoota kaanii akka ta'an hubachuudhaan ofii keenyas barree hawaasaas barsiisuudhaan dammeessuudhaan hubannoo jijjiiramaa hubannoo amalaa fiduu irratti hojjechuu qabnaan jedha kanumaan jedha galatooma.
Thank you so much, Mr. Bahar Omar. You have given us a very short, precise, and clear information on stigma, especially on what does it mean when we say stigma, and the other is about the cause, and then the last thing is about the solution. Thank you so much for that brief and clear presentation. Now, directly, I'll go to Mr. Henry Momanyi from Global Health Service. Henry Momanyi has been in this service for a long time. We've been doing African World AIDS Day for so long. He has a good experience on this. So you are welcome here to present your presentation in Swahili. You have to unmute yourself.
Okay, sorry. Yeah, thank you so much, Fikri, and the rest of the panelists, and those people who are wherever you are this evening watching this presentation from the African World AIDS Day. Yeah, my name is Henry Momanyi. I'm Executive Director of Global Health Services, and we are here in Broken Park. And now I switch to Swahili. Asante sana wote ambao mnatusikiza jioni hii katika hii sikukuu ya ukimwi ulimwenguni. Ukimwi ulimwenguni huwa tunakutana mwezi wa Disemba tarehe 1 kwa sababu shida za ukimwi zilikuwa zimetugemea sana wageni na wakimbizi wakati tumekuja hapa hii nchi ya Minnesota. Kwa hivyo wale watu ambao tumetoka nje, yani wageni, tukakutana tukasema ni lazima tukuje pamoja tuangalie hasa ni haji tutaweza pambana na hii vita vya ukimwi ambao imetugamia sana, watu wetu wamekufa sana, hata idara ya serikali ya Minnesota na taasisi zingine zile za kijamii za wageni tukaamuru ni lazima tuanze kufanya kazi ya jamii, tuone ni nini hasa inakuwa shida kwa hii kazi yetu tunafanya, yani stigma. Tukapata kuwa na uoa fear, watu huwa na uoa ndiposa hawataki kupata ile kanuni za kufanyiwa ukaguzi na kupata elimu juu ya ukimwi, alafu ndio utakaa maisha bora. Kwa hivyo hasa ile shida, wale walimu wa idara mbalimbali za serikali na taasisi mbalimbali za kijamii za wageni, yani refugees and immigrants, tukapata ni lazima tuangalie asha kila jamii, tuungane na wazee na watoto, tuambiane ukweli kuwa ukimwi sio kifo. Ukimwi, ukiwa na elimu juu ya ukimwi vile inaambukizwa, utaweza kuwa unakaa maisha bora na utakaa hata miaka yote ile unataka kukaa. Lakini usipokuwa na elimu ya ukimwi, ujue vile inaambukizwa, huwezi kujua maana yake. Kwa hivyo stigma, yani kutokuwa na amani na kuogopa kuambia watu mimi niko na HIV, I am having HIV, inakuanga ni shida sana. Kwa hivyo stigma ni kitu ngumu sana kwa jamii yetu ya wale ambao tunatoka nje, lakini tunajaribu sana vile tunaambatana hizi taasisi mbalimbali zinafanya hii masuala kufunza watu juu ya ukimwi. Tunaona tunajaribu kabisa, tunajaribu sana, lakini tena shida iko kubwa sana, kwa sababu watu wanaogopa watakataliwa katika jamii yao, watakataliwa hata kufanya hata kuolewa ama kuoa. Hakuna mtu ataki mkuje pamoja, huwezi kwenda kanisa. Ukiona mtu ukikuangalia naona huyu jamaa kuna ugonjwa wa ukimwi, unawekwa kando. Kwa hivyo sisi tunasema ukimwi sio shida. Shida ni kwamba kutojua maana ya ukimwi, alafu upate elimu juu ya ukimwi, alafu ukipata hiyo elimu juu ya ukimwi upate mahali unaenda unapata matibabu ya ukimwi. Ukipata matibabu ya ukimwi na ukijua mambo, ukiambiwa na daktari wako vile unaweza kaa, uwezi kuwa na shida. Kwa hivyo hii siku hii ya leo tunasema hakuna haja mtu kuogopa kupimwa, hakuna haja mtu kuogopa ati usiambie watu uko na ukimwi, kwa sababu kutosema ndio kunafanya ukimwi naendelea. Lakini ukisema mimi nakuanga na ukimwi, nimekuwa na ukimwi na miaka 20, nakaa, I'm okay, niko healthy, niko na afya, hakuna ubaya. Lakini ni shida sana kwa jamii zetu. Wawaja kuwa kabisa kujitolea kabisa kusema mimi niko na ukimwi. Ni shida sana, ni shida kubwa sana. Lakini tunasema kwa wale ambao wanakuwa na HIV hii kwa miaka tuseme miaka 10 au 20, wakiongea watu wetu wanaanza kuamini, kumbe kuna ukweli hapa. Kumbe kuwa na ukimwi sio kifo. Kwa hivyo leo hii vile tunafanya hii kazi ya kuambia watu wetu, kuwasomesha kidogo kidogo, ndio Waswahili husema kidogo kidogo hujaza kibaba. Inasaidia sana watu wetu kuwa na amani, kuanza kuenda kupimwa na kuanza kuencourage wengine nao kufanya hivyo. Kwa hivyo African World AIDS Day, hii siku ya Africans Meet, ni siku kuu sana na ni muhimu sana kwa sisi wale ambao tumetoka nje. Kwa hivyo naenda kumalizia kusema lazima tuwe tunafanya hii kazi katika jamii zetu, tuendelee kuambatana vile tunaenda kuambatana hizi taasisi mbalimbali za jamii za wageni wale ambao tumekuja hapa ndani na idara za afya hapa Minnesota. Tukiendelea kuzingatia tutafaulu, kwa sababu tukiona watu wetu wale ambao wako na virusi wakisema tumekuwa na virusi kwa miaka hii, tuko na afya, tuna kila kitu ni normal, inasaidia sana. Kwa hivyo wacha nipige tamati hapo, niseme shukrani sana na Mungu awabariki, na tuendelee kukutana kwa hii kazi ya kupigana na hii vita ya ukimwi ulimwenguni. Thank you very much, and I want to say in 3 words that let us keep doing this. Our partners and our collaborators, the HIV is there and it's real, but it's not final. HIV, you can have it, you can live the life you want to live. The only thing is when you don't know that you are HIV positive, you don't know, but when you are tested and you are put in care, you can live as long as it takes, like a normal life, like anybody else. So Victory and my other panelists, thank you so much for this opportunity. Please, let's keep doing it. Thank you and good evening.
Thank you so much, Mr. Henry Momanyi from Global Health Service. I know, even though I don't understand the Swahili, I can just understand from your gesture and from your emotion that you are in it. And then thank you so much for that presentation. So to save my time, I will go to my second presenter. My second presenter is my keynote speaker, Ms. Toabech Abaire. She is gonna share us her experience. She has a lot of experience. She's been with HIV/AIDS for the last 20 years, but she's gonna give us a very brief kind of things she encountered, especially regarding the stigma. ከዚህ በኋላ እንግዲህ የዓለም የአፍሪካ የኤድስ ቀንን እያከበርን ነው። በዚህ ቀን በአፍሪካውያኖች አንድ ላይ መተን በተለያየ ቋንቋ በዚህ ቀን መደረግ ያለበትን ነገር ትምህርት እየሰጡ ነው። ከዚህ በኋላ
yeah, that makes sense though. But I have one though.
Come on, no. Only Discover has no annual fee.
በተዋበች አባይሬ ከኛ ጋር ነች። እሷ ብዙ ልምድ አላት። ካላት ልምድ የተወሰነ ልምድ ነው የምትሰጠን ዛሬ። ከዛ እሷ ከተናገረች በኋላ ትንሽ እሷ የምትለውን በእንግሊዝኛ ብሪፍ ማድረግ እንሞክራለን። አሁን እሷን በጣም እናመሰግናለን። ጊዜውን እዚህ በፊትም ብዙ ህብረተሰብን ያስተማረች ኢትዮጵያም እዚህም ራሷን ለህብረተሰቡ ሰጥታ ያስተማረች ስለሆነ በጣም እናመሰግናታለን። የዛሬው የክብር እንግዳችን እሷ ነች። እሷ እንግዲህ አንዳንድ ነገሮችን በ5 ደቂቃ ውስጥ ትነግረናለች ብዬ ነው የማስበው። ጊዜው ያንቺ ነው። ቀጥይ።
እሺ፣ ስሜ ተዋበች አባይሬ ይባላለሁ ከሚኒያፖሊስ ሚኒሶታ። እንግዲህ ዛሬ በዚህ ፕሮግራም ላይ በመገኘቴ በጣም ደስተኛ ነኝ፣ ደስ ብሎኛል። ያው ስለ ማግለል ነው እንግዲህ በኤችአይቪ ዙሪያ ላይ ማግለል በጣም ከባድ ነገር ነው። ምናልባት ቃሉ ቀላል ሊሆን ይችላል። እንደው ማግለል ሲባል ትንሽ ነው ቃሉ፣ በውስጡ ግን ብዙ ጉዳቶች አሉ። ያን ጉዳት ደግሞ የችግሩ ባለቤት የሆነ ሰው ወይ ደግሞ ኤችአይቪ ቫይረስ በደሙ የሚገኝ ሰው በመገለል ውስጥ ያለፈ ሰው ነው የሚያውቀው። ያን ደግሞ እኔም አልፌበታለሁ፣ ምን ያህል ችግር እንዳለው ማለት ነው። በኢትዮጵያ ውስጥ ሆኜ በኤችአይቪ ዙሪያ ሳስተምር ብዙ መገለሎች ደርሰውብኛል። በሰዎች ላይ የሚደርሱ መገለሎችን አይቻለሁ። በጣም ከባድ ለመግለጽ እንኳን መቼም አጠር አድርጌ ነው ይሄንን ነገር መነግራችሁ፣ ብዙም ሰዓት ስለሌለን ሌላ ጊዜ በሰፊው እንገናኝ ይሆናል። ብዙ ችግር አለው ማግለል። በማግለል ምንም የሚገኝ ነገር የለም። ኤችአይቪ ኤድስን መክታት አንችልም በማግለል። እንደውም ኤችአይቪ ቫይረስ በደማቸው ያሉ ሰዎችን በማቅረብና በመቀራረብ ማበረታታት ሲገባ ህብረተሰቡ ግን ኤችአይቪ ቫይረስ በደሙ ያለውን ሰው ያገላል። ኤችአይቪ አሁንም አለኩ። እኔ ኤችአይቪ ቫይረስ ተመርምሬ ራሴን ካወቅኩኝ ወደ 20 ዓመት አስጠግቻለሁና ቫይረሱ ዛሬም አለ። ዛሬም ሰዎችን እያጠቃን ያለው፣ አዋቂዎችን ህፃናቶችን ሁሉ እያጠቃን ያለው። በመገለል ዙሪያ ግን ብዙ ችግር አለ። ሰዎች መድኃኒታቸውን እንዳይወስዱ በአግባቡ ህክምና እንዳይከታተሉ ያደርጋል። አንድ ኤችአይቪ ቫይረስ ያለበት ሰው ወደ ህክምና እንኳን ለመሄድ ይፈራል። ምክንያቱም አንድ ሰው እዛ ቦታ ላይ ካየኝ በኤችአይቪ ቫይረስ በደሙ አለ በሚል ሊያገሉኝ ይችላሉ እያለ ህክምና ክትትል የማያደርግ ብዙ ሰው ነው ያለው፣ በጣም ብዙ ሰው። ከዛም አልፎ ደግሞ ለቤተሰብም እንዳይነግር እናት ልጇን፣ አባት ልጁን፣ ወንድም እህት ወንድሙን እያገለለ ያለበት ወቅት ነው። በኤችአይቪ ላይ ብዙ በማግለል ብዙ በደሎች ተሰርተዋል፣ አሁንም እየተደረገ ነው። ስለዚህ ማግለል ቢቆም ይሻላል። ኤችአይቪ ኤድስን እኛ እንደው ማጥፋት ባንችል የምንቀንሰው ኤችአይቪ ቫይረስ በደማቸው ያላቸውን ሰዎች በመንከባከብ ተጠግቶ በማውራት እነሱን ማበረታታት እንጂ ማግለል ጥቅም የለውም፣ ምንም ጥቅም የለውም፣ ጎጂ ነው። እንደውም እንደነገርኳችሁ አንደኛ ህክምናን በአግባቡ እንዳይወስዱ ያደርጋል። ሁለተኛ በግልጽ በህክምና ክትትል አድርጎ ራሱን እንኳን ለማዳን እንኳን ጊዜ አይሰጥም ማግለል። ሰዎች በማግለል የተነሳ ከቤታቸው ከተከራዩ ቤት እንኳን ተፈናቅለው ሜዳ ላይ ተጥለዋል። ኤችአይቪ ቫይረስ በደሙ ያለ ሰው እኮ ትምህርት ቤት እንዳይሄድ ሁሉ ተደርጓል በማግለል። ሌላው ቀርቶ እናት እኮ ኤችአይቪ ኤድስን አልመረመርም ብላ ወይም ኤችአይቪ ቫይረስ በደሙ ያለ ምርመራ ሳታደርግ ወደ ህክምናው ሳትሄድ ኤችአይቪ ቫይረስ በደሙ ያለ ልጅ ሁሉ የሚወለድበት ጊዜ እኮ ነው። ምክንያቱም ሄዳ ክትትል አታደርግም፣ ህክምና አታደርግም። ኤችአይቪ ኤድስ እኮ ከእናት ወደ ልጅ እንዳይተላለፍ ህክምና አለው፣ መድኃኒትም ይሰጣል ከእናት ወደ ልጅ እንዳይተላለፍ። ይሄም ግን በማግለል የተነሳ እናት ወደ ህክምና ማዕከል ሄዳ አገልግሎቱን እንዳታገኝ ያደርጋል። በጣም ከባድ ነው ማግለል። ስለዚህ ማህበረሰቡ የኤችአይቪ ግንዛቤ እንዲያገኝ ማንም ሰው ቫይረሱ በደም ያለው ሰው ወጥቶ ማስተማር ባይችልም እኛ የምናቀውን ያህል እንኳን ስንናገር ሰዎች ከኛ ትምህርት ወስደው ሌሎቹን እንዳያገሉ ሌሎቹን እንዳይገፉ ማድረግ አለብን። ይሄን የሰማ ደግሞ ይሄን መቀበልና ለሌሎችን ማስተማር መቻል አለበት። በአገራችን በተለይ በኢትዮጵያ በጣም ከባድ ማግለል ነው ያለው። በጣም ከባድ ህፃናቶች እኮ ኤችአይቪ ቫይረስ እንኳን ኖሯቸው ህክምና ካደረጉ የሚከታተሉ ከሆነ ጎረቤት ለልጅ ቤተሰቡ ውስጥ ሲያወራ ልጅ ይሰማል። ከዛ ልጅ ይወጣና ይሄ ልጅ እኮ እንደዚህ ያለበት ይላል። ትልቅ ማግለል ነው። ልጆች እንኳን ማግለልን እንዲለምዱና ውጪ ወጥተው ሁሉ እንዲናገሩ ሁሉ የሚያደርግ ነው ማግለል። ቤተሰብ ይሄን ነገር ጠንቅቆ ስለ ኤችአይቪ በደንብ አውቆ ማንበብ፣ ሚዲያ መከታተል፣ እንደኔ ያሉ ሰዎች ኤችአይቪ ቫይረስ በደማቸው ያሉ ሰዎች ሲያወሩ ምንድነው ብሎ ግንዛቤ መውሰድና መማር ለሌሎችን ማስተማር ያለብን። ስለዚህ ማግለል ይቁም ነው የምለው። ማግለል ይቁም። በጣም ብዙ ሰዎች ህክምና አገልግሎት እንዳያገኙ ወደ ህክምና ተቋም እንደ ሰብ-ሳሃራ ያሉ አገልግሎት በኤችአይቪ ኤድስ የሚሰጡ ድርጅቶች ጋር ሄዶ አግባብ ያለውን አገልግሎት እንኳን እንዳያገኙ የሚያግድ ነው። ምክንያቱም ይፈራሉ። ሰዎች እዛ ካገኙኝ ካዩኝ ምን ይሉኛል፣ ነገ ስሜን ያጠፋሉ፣ ምን ይላሉ፣ ይናገሩብኛል ይላል። ስለዚህ ይሄ ሁሉ ምንድነው በማግለል የተነሳ የሚመጣ ነገር ነው። ስለዚህ ኤችአይቪ ኤድስ እንደማንኛውም ሰው በሽታ ነው። እንደማንኛውም በሽታው እንደዚህ ከባድ ተብሎ የሚነገርለት አይደለም። ዛሬ ኮሮና ቫይረስ እኮ ይሄው አለያይቶናል። ራሱ አስገለለን እኮ እንዳንገናኝ አብረን ሆነን እንዳናወራ አድርጎናል ኮሮና። ኤችአይቪ ግን እንደዛ አላደረገንም። ሰዎች ናቸው የሚገፉን። ሰዎች ናቸው ቫይረሱ በደማችን ስላለ እኛን ወደነሱ እንዳንጠጋ ከነሱ ጋር እንዳንሆን ማህበራዊ ኑሯችንን እንዳንኖር የሚያደርጉን ኤችአይቪ ቫይረስ ተመርምሮ የማያውቁ እነሱ ይኑርባቸው አይኑርባቸው አያውቁም። ኤችአይቪ ኤድስ እኮ የሚታወቀው በማየት አይደለም። ኤችአይቪ ኤድስ ስለከሳ ስለወፈረ እኮ አይደለም። ዛሬ እኔ ኤችአይቪ ኤድስ አለብኝ ስላልኩ እንጂ ማንኛውም ራሱን ተመርምሮ የማያውቅ ሰው መሀል ሄጄ ብቀመጥ እሷ ኤችአይቪ አለባት የሚለኝ ሰው ማንም የለም። ሊያወጡኝ አይችሉም ከሰዎች መሀል ስለተናገርኩ ነው፣ አለብኝ ብዬ ስላወራው ነው። ስለዚህ ሰዎች ደግሞ ኤችአይቪ ቫይረስ በደሙ መኖሩን የሚያውቁ ሰዎችን ማግለሉ ማቆም አለባቸው። ይሄን ነው የምንታገለው። እኔ ለብዙ አመት ታግያለሁ። ኤችአይቪ ቫይረስ በደሜ መኖሩን ካወቅኩ ከ2 አመት በኋላ ነው ወደ ህዝቡ የወጣሁትኝ፣ ህዝብ ማስተማር የጀመርኩትኝ። ብዙ ችግር ነው ያለው። ከቤት እየተባረረ ከተከራየበት ቤት እየተባረረ ስንት መከራ ስንት ችግር ነው ኤችአይቪ ቫይረስ በደማችን ያሉ ሰዎች የምንቀበለው። በሰዎች ራሳቸውን ተመርምረው ባላወቁ የኤችአይቪ ኤድስን ስም የማይጠሩ ሰዎች እኛ ግን አለብን ብለን ወተን ስለተናገር ወይም ተደብቆ የሚኖሩ ሰዎችን እየገፉ ኤችአይቪ ኤድስን እንዳይከላከሉ አገልግሎቱን እንዳያገኙ እያደረጉ ነው። ስለዚህ ይሄ ለትውልድ እንዲቀር ይሄን ማግለል የሚለውን ነገር ትውልድ እንዳይከተል እኛ ከወዲሁ ይሄን ማግለል ማጥፋት አለብን፣ ማቆም አለብን፣ አዌርነስ መስጠት አለብን ለህዝቡ። ስለዚህ ስቲግማ ይቁም፣ መቆም አለበት። ለሁሉም እኔ ባለሁበትም በሌላም በተለያየ ሚዲያ አስተምራለሁ። ማንም ሰው ኤችአይቪ ቫይረስ ስላለበት ወጥቶ ይናገር ወይም ደግሞ ወጥቶ ስለ ስቲግማ ያወራ አይደለም፣ ወይም ስለ ኤችአይቪ ይናገር አይደለም። ራሱን ጠብቆ ተመርምሮ ራሱን አውቆ በነፃነት አገልግሎትን ማግኘት ይችላል። የህክምና አገልግሎት የተለያየም በኤችአይቪ ኤድስ ላይ የሚሰሩ ድርጅቶች ጋር አገልግሎት ማግኘት ይችላሉ። ስለዚህ ይሄ እንዳይሆን ደግሞ ሰዎች እየገፉ ስቲግማ እያደረጉብን መገለል እያደረጉብን ስለሆነ ይሄን እንታገላለን። እንግዲህ ይሄው ነው ያለው ነገር። ባጭሩ ጊዜ እንዳልፈጅባችሁ ነው። በጣም ነው ማመሰግነው። ሁላችንም ኤችአይቪ ኤድስ መመርመር አለብን። ማንኛውም ሰው በሽታው እኮ አለ፣ ዛሬም አለ እኮ፣ አልጠፋም እኮ አለ። ድምፅ አልባ እኮ ነው። ዝም ብሎ በደማችን ውስጥ እኮ የሚቀመጥ ነው። ካልተመረመርን ካላወቅነው ደግሞ ልክ እንደኔ 20 አመት መቁጠር አይቻልም። ምክንያቱም ከታመምን ሰዎች ኤችአይቪ ቫይረስ ልመርመር አይሉ፣ ደም ግፊት፣ ስኳር፣ ሌላ በሽታ ነው የሚመረመሩት። የኤችአይቪ ኤድስን ስም ግን አይጠሩም። መጥራት አለባቸው፣ ማወቅ አለባቸው ለራሳቸው። ስለዚህ ማንኛውም ሰው ኤችአይቪ ኤድስን እንዲመረመር አበረታታለሁ። ራሱን ማወቅ አለበት፣ ራሱን መከላከል አለበት፣ መኖር አለበት። መኖር እንችላለን። ኤችአይቪ ቫይረስ በደማችን ያሉ ሰዎች መኖር እንችላለን። አንኖርም ሰዎች የሚያደርጉትን ነገር አናደርግም ብላችሁ ተስፋ የቆረጣችሁ ሰዎች በፍጹም እንዳትሸወዱ። እኔ 20 ዓመት ሕክምናዬን እየተከታተልኩ መድኃኒቴን በአግባቡ እየወሰድኩኝ ነው ይሄን ያህል ጊዜ ኖርኩት። አለበለዚያ ግን መኖር አይቻልም። ምክንያቱም ከባድ ነው። በሽታው ዝም ብሎ ይቀመጥ እንጂ ሁሉንም ደረጃ እየጠበቀ የመጨረሻው ደረጃ ኤድስ ደረጃ ስንደርስ አልጋ እንይዛለን፣ መዳን የለም። ስለዚህ እዛ ደረጃ እንዳንደርስ ጊዜው ጥሩ ነው። ሕክምና በአግባቡ መውሰድ እንችላለን። ስለዚህ ሁላችንም ኤችአይቪ ኤድስን ተመርምረን ኤችአይቪ ኤድስን መዋጋት መቻል አለብን። ስቲግማ ይቁም መቆም አለበት። እሱ ነው ብዙ እንደውም እንዳንራመድ እያገደን ያለው። እኔ እንኳን እየታገልኩ ነው፣ ግን ተደብቀው የሚኖሩ ወንድሞቼ እህቶቼ ግን አሉ፣ ዛሬም አሉ፣ የትም መነቃነቅ ያልቻሉ፣ ከቤት እየተባረሩ፣ ከተከራዩበት ቤት እየተባረሩ፣ ከስራ ከሚሰሩበት የስራ መደብ እየተቀነሱ ታች እየወረዱ እንዲሰሩ እየተደረጉ አይችሉም፣ ኤችአይቪ ኤድስ አለባቸው፣ ከዚህ ስራ መነሳት አለባቸው ተብለው ተወግደው በፊት እኔ ኢትዮጵያ በመሰራ ሰዓት ፍርድ ቤት ቆመን ተከራክረን ወደ መጀመሪያ የስራ ድርሻው የመለስነው ሰው አለ። ይሄ ሁሉ በደል አለብን። ስለዚህ ኤችአይቪ ኤድስ ስቲግማ መቆም አለበት፣ ማግለል መቆም አለበት። ጊዜያችሁን እንዳልፈጅባችሁ በጣም ነው የማመሰግነው። እዚህ ፕሮግራም ላይ በመገኘቴ በጣም ደስ ብሎኛል። ቴንክ ዩ ሁላችሁንም።
በጣም እናመሰግናለን እህታችን ተዋበች። እንግዲህ ከኤክስፒሪየንስ ስለሆነ ብዙም ምንም የሚያስቸግርሽ ነገር የለም። ያው ማፍለቅ ነው። እንግዲህ ሌላ ረጅም ጊዜ የምናገኝበት ጊዜ ይመጣል ብዬ ነው ማስበው። በጣም ነው የምናመሰግነው። ለአርአያ መሆን ማስተማር ቀላል አይደለም። ሰው ሲደርስበት እንዲህ ወጥቶ ለሰው ብሎ ያንን ሁሉ ማድረግ ሳክሪፋይስ ማድረግ ነው። ህይወትን አሳልፎ ለሌላ መስጠት እንደ መስጠት ነው የሚቆጠረው። በጣም እናመሰግናለን። እግዚአብሔር ይስጥልኝ። just make a few points on what Tawabech has been talking. As I've said, Tawabech has been with HIV/AIDS for the last 20 years. And then she's been through so many challenges, problems, discrimination, so many panic conditions, and so many things. The thing that very interesting, she said in the beginning, stigma is just a word. When we say it, it is just a word. But in that word, there is a lot of things. When we say stigma, discrimination, for some people, it might be just a word, but it is not just a word. There is a lot of things in there. The other thing is she speaks that what she has faced in Ethiopia, in social services, in healthy care services, at the school, and so many discrimination was there. She been fighting with that all, because there is discrimination everywhere. If somebody is living with HIV/AIDS, so the discrimination is there. The other point she pointed out is we cannot do anything better by refusing each other, by making putting somebody aside and looking somebody as a second-class citizen because that person is HIV positive. We cannot do better by doing that, because HIV is around. It has been 14 years since we heard HIV/AIDS. It is killing millions of people around the world. We cannot do something better for our community and our world by ignoring somebody who is HIV positive. So if we discuss together, if we come together, if we teach each other, we can do better. We can eliminate HIV transmission, new transmission. We can support those people who are living with HIV/AIDS. The other thing is there is discrimination everywhere. There is a self-stigma. Somebody can stigmatize themselves if they are HIV positive, and if they are not just talking about their problem that they have HIV/AIDS. Tawabech, she mentioned that there is no any magic thing I did living with HIV for 20 years. What I did is I just get tested on time and then continue my medication, stick with my medication, helping people, helping myself. That is the magic behind I'm living a healthy life for the last 20 years. The other thing is what she said is sometimes if we don't have any information about HIV/AIDS, some women give birth to a baby who is HIV positive. if they go to the health institutions and take medication, they can have a healthy baby. But if they don't have any information, a pregnant woman doesn't have any information, even before she got pregnant, if she doesn't have any information, she's gonna give birth to HIV positive. But if she go on time, she can have very healthy baby. So thank you so much, Tawabech, for that deep and very exciting, informative presentation. As she said, we will have time in the future. She has a lot of things to say. She just say a few things. She's been in it for the last 20 years, and then she has some experience. Time in the future. I hope we will have a time in future. I will go to my next presenter. My next presenter is Dr. Osman Ahmed from East African Health Project. Dr. Osman has been in this fighting HIV/AIDS for a long time as a health minister back in Somalia, and he's been doing a lot of job here. Dr. Osman is here with Mr. Abdi Hakim. Somali National TV is recording. We'll have all record, and thank you so much. I would like to say thank you so much for Abdi Hakim too for recording this event. It is your time, Dr. Osman, to speak in Somali.
Assalamu alaikum wa rahmatullahi wa barakatuh. Somali meel kastoo aad joogtaanba. Maanta waxaan ka hadlaynaa cudurkan HIV/AIDS-ka la yiraaho. Waxaan oga hadlaynaa waxa weeye waa sanadkii 16aad oo looga xasuusto cudurka isaga ah xagga Afrika. Sababtoo ah cudurkan HIV/AIDS wuxuu aad iyo aad ugu badan yahay Afrika. adduunyada hadda cudurkan waxaa la nool ilaa 38 milyan, ugu yaraan 25 milyan iyo in ka badanba waxay ka nool yihiin Afrika. Marka sidaa darteed ayaa maalintan oo kale waxaa la xusaa ama dadka la xasuusiyaa khatarta cudurka uu leeyahay iyo sida iskaga ilaalin lahaayeen. HIV/AIDS marka u horeysa waa hal cudur oo laba marxaladood ah. HIV-ga AIDS-ka waa hal cudur oo laba marxaladood kala jooga. Macnaheedu waxa weeye cudurkan markuu viruska jirkaada galo waxaad ku jirtaa marxaladda HIV. Markii uu marxaladaas muddo fara badan aad la nooshahay oo baabi'iyo awoodda difaacaada ayaad waxaad gelaysaa marxaladda labaad oo ah AIDS-ka. taasna waxay keenaysaa marka in cudurkii labada magac uu wato isagoo hal cudur ah. HIV/AIDS aan maanta rabnaa awoodda inaan saarno maxaa cudurkan loo ceebaystaa, maxaa xagee ka imaanaysa istigmada cudurkan xagee ka imaanaysa, maxaa sababaya. ma ay jirto sabab loo sababo cudurkan inaad ka xishootid oo aad cudurada kale si aad uga xishoonaynin aad uga xishootid, lianna waa cudur caadi ah oo la kala qaado. cudurkan waxaa lagu kala qaadaa galmada, waa lagu kala qaadaa caadiga ah maanta iyadaana ugu badan sida lagu kala qaado cudurkan iyada. waxaa kaloo cudurkan lagu kala qaadaa haddii dhiig qof qaba lagu shubo. waad ogtihiin Afrika waxaa u badan in dhiig badan lagu shubo qofka markii uu dhiig bax ku dhaco ama maartay shiil baabuur galo ama dhiig la'aan intii ku dhacdo maartay u baahdo dhiig in dhiig lagu shubo. waxaa laga yaabaa dhiiggaas inaan si fiican loo baarin oo aad ka qaadid cudurka isaga dhiiggaas lagu shubay. waxaa kaloo ka qaadi kartaa cudurka isaga ah cirbad farmashiyo lagaaga duray oo aan nadiif ahayn oo qof qaba cudurka lagu duray. marka maadaama cudurkii sidaa lagu kala qaadayo, xishoodka aad ka xishoonaysid ama ka ceebaysanaysid maxay tahay? taa waaye ahamiyadda loo baahan yahay. tan kale waxa waaye oo yaab kale, Soomaalida waxay ka xishootaa cudurkan HIV/AIDS oo qofka tira cudurka iska baar wuxuu ku leeyahay maya cudurlaahi ma qaba cudurkaas. isla markaana way ku imaanayaan oo waxay ku leeyihiin waxaad iga baartaa cudurka hepatitis B iga baar. HIV/AIDS iyo hepatitis B isku sibaa loo kala qaadaa. cirbadaha la isku diraa lagu kala qaadaa, galmada lagu kala qaadaa dhiig lagu shubaa lagu kala qaadaa hooyo uur lah oo ilmaheeda caloosha ugu gudbisa ama markay dhalaysa u gudbisa ama caanaheeda ugu gudbisa ayaa lagu kala qaadaa HIV AIDS iyo hepatitis B-ga waxay ku kala duwan yihiin caanaha hooyada HIV-ga waa la socdaa laakiin hepatitis B-ga lama socdo laakiin labadaba waa virus marka arrinta haddii sidaa tahay maxaa keenaya waxa kan la yidhaaha stigmada oo qofka inuu ka xishoodo waa cajiib soomaalida lay qabta arrinta iyada waxaad arkaysaa soomaalida waxyaalaha kale oo lagula yaabo waxay ka xishoodaan oo kale ama ay stigma ka qabaan TB-ga oo kale laakiin isla markaas kama qabaan xishood ama inay ka xishoodaan ama ceebaystaan inay yidhaahaan iga baar syphilis iga baar oo ka mid ah cudurrada galmada lagu kala qaado marka arrinta iyada ayaa waxaa loo baahan yahay in cudurkan isaga ah adduunyada aad iyo aad ugu badan yahay maanta adduunyada 38 milyan iyo ka badan ayaa ku nool waddankan hadda Mareykanka 1,200,000 oo ka badan ayaa qaba cudurka isaga ah statekeenan Minnesota haddaan u niisoo qaado 9,193 qof ayaa qabta cudurka isaga ah oo 5,000 ay tahay marxaladda HIV 4,000 ay tahay HIV AIDS ay meelka u gudbeen marka waxaa loo baahan yahay qof walba inuu cudurka isaga iska baaro weliba marxaladdan hadda aan ku jirno oo coronaviruska ah cudurkan HIV adigoo qaba haddii coronaviruska kugu dhaco khatar aad iyo aad ayaad gelaysaa sababta waxa waaye cudurkan HIV AIDS wuxuu dadka ka baabayaa difaaca jirka difaacaadii oo cudurrada iskaga difaacaysay ayuu baabi'inayaa taasaa waxay noqonaysaa qof aan jirkiisa wax difaac haba yaraata lahayn marka cudurkan coronaviruska ah iyo cudurrada kaleba isbaad ugu jirta inay ku dilaan laakiin hataa laga yaabo ay awooddaada i ficnaan lahayd in cudurkaas ka badbaadi marka Soomaalida waxaan ka codsanaynaa cudurkan isaga ah inay iska baaraan maanta baaridiisa way sahlan tahay waad iska baari kartaa si tartiib ah iskaga baari kartaa waxaad iskaga baari kartaa adoon xataa magacaada la qorin baad iskaga baari kartaa si aad u ogaatid xaaladda aad ku jirto adiga lianna cudurkan haddii intaad qabtid aad dadka kale u gudbisid waxaad tahay qof dembi galay waxaad la mid tahay qof dilay ama xabad ku dhuftay qof ama midi ku dhuftay qof kale mana ogeyn ma ay anfacayso barka awood baad u leedahay maanta inaad cudurka iska baarto marka fadlag Soomaali waxaan ka codsanaynaa meel kasta ay joogaan cudurkan isaga ah waa cudurrada la iska ilaalin karo waa cudurrada aan ku soo doonanaynin laakiin adigu aad raadsanaysid waa cudurrada si sahlan aad uga qaadi kartid meel caafimaad oo tagtay oo nadaafadeed ay xun tahay ama ilkaha ha ahaato ama qalliin ha ahaato ama dhiig lagu shubay ha ahaato waa cudurrada saa loo kala qaado ama haddaad la galmooto dad cudurkaas sida marka waxaa loo baahan yahay qof walbaba xaaladdu ku sugan yahay maanta inuu ogaado oo cudurka iska baaro taasaad waxaad ogaanaysaa inaad cudurkii qabtid iyo inaad qabin haddaad cudurkii qabin alxamdulilah waa iska ilaalin kartaa kusoo raadsan maayo sida coronaviruska qof kale kuusoo gudbinaya xagga jooga ma aha laakiin haddaadba ogeyn oo adigii aad fidinaysid waa dhibaato meesheeda taala marka iska baar lagu yidhaahna inaad ka xishooto oo maaragtay ceebeysato ma aha cudurkan waa cudurrada caadiga oo ka mid yahay adduunyada ilaa 40 sano ayuu ka socdaa 1981 ayaa qofkii ugu horreeyay laga helay ilaa waqtigan xaadirka ane ilaa 38 milyan oo qof ayaa adduunyada qabta sanadkii hadda la soo dhaafay 2019kii 690,000 oo qof ayaa u dhimatay cudurkan isaga ah marka ma aha cudur la yaraysto ma aha fadlag waxaan Soomaalida ka codsanaynaa meel kasta oo joogaanba inay cudurkaas isaga ogaadaan jiritaankiisa inay iska baaraan baaritaankiisa waa sahlan yahay waa lacag la'aan daqiiqada gudahooda ayaa lagugu sheegi karaa in cudurka jirkaada ku jira in kaleento marka fadlag Sub-Sahara la soo xiriiri kartaan hadaa iska rabtaan in iska baartaan aniga ila soo xiriiri kartaan oo iyaga maaragtay meelaha lagu baari geynaa meelo badan oo la iskaga baaro ayaa jirta maaragtay cudurka isaga ah laakiin waa muhiim qof kasta oo Soomaali ah inuu ogaado inuu cudurkaas ka madax bannaan yahay uu qabin markaasna uu iska ilaaliyo fadda qofkii qabana waxaan ka codsanaynaa dadweynaha qofkii cudurkan laga helo inaan la takoorin qalad baa looga fahmay cudurkan isaga qofka hadduu cudurkan ku dhaco waa cudurada ilaahay keenay oo dadka ku dhacaya marka looma baahna qofkii qaba in cudurkan la takooro oo la yiraaho cudurkaas uu qabaayo laga cararo guryaha laga xirto laga magiciisiyo ma aha cudurkan hadduu familka qof ka mid ah uu ku dhaco waxaad qofkaas cudurka familkiisa kuma daaran karo waa la noolaan kartaan darkiisaad qaadan kartaan waxbaad la cuni kartaan asalotamaanta cudurkaas ma aha in cudur laisku takoora ma aha ahmiyadda ugu weynna waxa waaye inaan cudurkaas qofka lagu takoorin marka fadlag cudurkan cudurrada caadiga uu ka mid yahay waa inaad saas fahantaan oo meel kastoo aad joogtaanba cudurkaa iska baartaan tan waa daryeelka caafimaadkiina waa ilaahay wuxuu maskaxda noo siiyey inaan maaragtay maskaxdeena isticmaalno oo aan dadka kalena cudurrada ka badbaadino annakana iska badbaadino marka fadlag waxaa muhiim ah in cudurkii la iska baaro in qofkii qabo aan la takoorin in maaragtay la daryeelo in la soo dhoweeyo in maaragtay qof walba lagula taliyo inuu cudurkaa iska baara siiba weliba marxaladan coronaviruska uu jiro waa cudur khatar ah haddii labadan cudur ay kugu kulmaan nafsadaada halis bay ku jirtaa marka fadlag waxaan soomaalida ka codsanaynaa inay cudurkaa isaga iska baaraan meel kasta ay joogaanba ayna ogaadaan in cudurkan uu yahay cudurrada lagu kala qaado galmada cudurro badan oo galmada lagu kala qaado oo hepatitis B-ga soo sheegay ee syphiliska aan soo sheegay cuqdad kama qabno laakiin kan inaan ka qabna waa qalab waxaaba laga yaabaa in dhiig lagugu shubay ama farmashiye ama maaragtay meel caafimaad aad ka soo qaadayba waxaa laga yaabaa hooyo umuleysa oo dhiig bax ku dhacday in dhiig lagu shubay oy ka qaaday maxaa marka xishoodka keenaya ma aha marka galmada caadiga ahna lagu kala qaadaa maanta iyagaana ugu badan waxa lagu kala qaado waagii hore la dhihi jiray dad gaar ah ayaa cudurkaas u gooya waxaas waa laga gudbay ma jiraan cudurkan isaga ah waxaa lagu kala qaadaa galmada caadiga ah waxaa lagu kala qaadaa dhiig lagugu shubay waxaa lagu kala qaadaa hooyo dhalayso ilmaheeda u gudbisay intii caloosha ku jiraan markay dhalayso iyo markay nuujinayso waxaa lagu kala qaadaa cirbad qof qaba lagu diray oo adna lagugu diray marka wax laga xishooda meesha bayaalaan wax maaragtay cudurkan laga dhigo cudur takoor ama jiraan dadka qabana cudurkan waa in la soo dhoweeyaa oo maaragtay si caadi ah loola dhaqmaa lianna dadka guriga jooga marna maba ku daaran karaba musqulaha laguma kala qaado salaanta laguma kala qaado dharxirka la xiriirta laguma kala qaado marka qofkii inaad kortid mamnuuc waaye waaba qalad markaas intaas baan kusoo gabagabaynaynaa fadlag waxaa waaye cudurkan isaga ah aan iska baarno aanan la soconno dadka qabana aan soo dhoweyno annakana aan iska ilaalino ilaalada waxaad cudurka iskaga ilaalin kartaa inaadan la galmoonin qof aadan ogeyn inuu cudurkan qabo waa inaa iska ilaalisaa taas waa inaa iska
Can you summarize Dr. Osman because you're taking
waxaad yeelaysaan cudurka isaga ah waa inaan la dagaalnaa waxaan ula dagaalaynaa inaan iska baarno asalaamu calaykum waraxmatullaahi wabarakaatu
Thank you so much, Dr. Osman Ahmed. I know people like to listen to you. You have been in this HIV thing for a long time, and then you are well received by the community, and the people like to listen to you. I hope they will get a lot of information, a lot of education, a lot of knowledge from there. Thank you so much for your presentation. Directly, I will go to my next presenter. Stay tuned. We have only left with 2 people, and the last one is now I'll go with Mr. Samuel Taklaab. After that, I have Mr. Abdullah Sheikha, who was highly experienced, been around for a long time, and he's gonna present in English. Before I do that, I will go with Mr. Samuel Taklaab from Eritrean community, especially from the Eritrean radio community radio services. You are welcome, Mr. Samuel.
Okay, thank you.
Tikrinya
Thank you.
for
Thank you.
5 minutes. It
هو
is so
تقريبا
beautiful to bring a lot of language here, and it is so beautiful. Thank you so much for coming.
ثانك يو
Time.
ثانك يو هراي ثانك يو قنير لي مجمرتا بزعبات إيش كنزارب كلنا ونكا اتش اي في ايش تبعي السبع كما يمرقسيو بالمنتايو نحن نحللنا تا اتش اي في تبعال تاترجما قلب بالانجليزية اتهلو human immune efficiency virus يعني HIV تبعها كلا صحجي انت تقبر انت اذا قبر نت دخام امين نت فايت المقبار نت حمام كقاطمنا خلو نفايت المقبار نتقملوتهم اب بلاد زلو اب دم زلو سعادو وهيوتات نعاتو يعتقد حجي نابو نابت حمام نابتو كاب HIV positive مخان قصيلካ ናብታ ኤድስ ሕማም ትሰግር ማለት እዩ ሕጂ ኣብ ሎሚ መግለፂ ተዋሂቡ ዝክወሃብ መዲቡ ዘሎ ተነፅሎታት ማሕበራዊ ተነፅሎታት ከመይ ጌርካ ንኤድስ ዝሓዞ ሰብ እንታይ ዓይነት ችግር ፈጥር እዩ እቲ ዋና ዘረባ እቲ ቶፒክ ተታሒዙ ዘሎ እሞኒ ብዛዕባ ክዛረብ እቲ ኤችኣይቪ ዝሓደ ሰብ ፅቡቅ ጌርካ ዘይምርዳእ ኤችኣይቪ ዝሓዞ ሰብ ከዓ በቲ ቫይረስ ተለኽበ ሰብ እንታይ ዓይነት ፀገም ፈጥራ ኣብቲ ማሕበረሰብ ኢልካ ብግማት እዩ ትሽክር ኩሉ ሻዕ ዝመፅእ መብዛሕትኡ ግዜ ከም ሕጂ ዘለናዮ ከም ኮቪድ 19 ብምስዓል ዝራኸብ ከዓ ብስእልካ ክትስዕል ከለኻ ወይ ከዓ ብጥፍጣፍ ወይ ከዓ ብኢድ ብምርኻብ ወይ ከዓ ሸሓኒ ቢያቲ እንዳተጠቐምካ ኤችኣይቪ ዘለዎ ሰብ እንዳተጠቐምካ ከምኡ ዝሕዘና ኮይኑ ይስምዓና ብክልተ ነገር እዩ ኣተኩሮ ናይ ኤችኣይቪ ኩሉ ሻዕ ዘጋጥም ሓንቲ ዝኣቱ በቲ ነቲ ኤችኣይቪ ክላገበና ዝኽእል ዘሎ ሓንቲ ብደም እዩ ብደም ገይሩ ዝመፅእ እቲ ካልኣይ ድማ እቲ ሲመን ዝበሃል እቲ ብፆታዊ ርክባት ዝግበር እዩ ዝተሓላለፍ ካልእ ብምትንካፍ ወይ ከዓ ኤችኣይቪ ዘለዎ ሰብ ተንኪፍካ ወይ ከዓ ዘሪብካ ወይ ከዓ ዝበልዓሉ ቢያቲ በሊዕኻ ኦር ሳምቲንግ ከምኡ ዝመፅእ ነገር ብኡ ዝተሓላለፍ ሕማም ኣይኮነን በዚ ክንርዳእ ኣለና ሕጂ ኣብ ማሕበረሰባት ምናልባት በተፍልጦ ዘይብሉ ማሕበረሰብ ነዞም ሰባት ምትንካ ኤችኣይቪ ፖዚቲቭ ዝኾኑ ሰባት ተነፅሎታት የጋጥሙ እቲ ተነፅል ከጋጥም ከሎ እንታይ የምፅእ ነቶም ብኡ ተለኺፎም ዘለው እቲ ዲፕሬሽን ክመፅእ ይኽእል እዩ ገለገሊኦም ሓደ ሓደ ግዜ ካብኡ ዝገደደ ስጉምቲ ክወስዱ ይኽእሉ እዮም ግን ሕጂ ኣቐዲምና ብሓያ ክትዛረብ ዘተ 10 ዓመት ተታሒዘ ነራ ዝገልፅ ጌስታት ዝነበረ ከምቲ ዝገለፀቶ ሙሉእ ላይፍ ኤችኣይቪ ፖዚቲቭ ኮንካሲ ሙሉእ ላይፍ ክተካይድ ትኽእል ኢኻ ዋላ ሓንቲ ዝጎድለካ ማለት ከምዚ ኖርማል ላይፍ ብታ እቲ ኣምላኽ ዝፈቀደልካ ኖርማል ላይፍ ክትቅፅል ትኽእል ኢኻ ብመድሃኒት እንዳወሰድካ ማለት እዩ ሕጂ እቲ ተነፅሎታት ነቲ ፀቕጢ ዝገብሮ ነቲ ኤችኣይቪ ዝሓዞ ሰብ ከቢድ ፀቕጢ ዝገብረሉ እዩ እንታይ ዝገብረሉ ፀቕጢ ኩሉ ሻዕ ነቲ ሰብ ካብቲ ሰብ ስለ ዝንፅሎ ቀርቦ ሰላም ዝብልዎ ሰባት ከማን ክፈርሁ ይኽእሉ እዮም ግን እቲ ኤችኣይቪ ዝመሓላለፍ ግን ብደምን ብሲመን ምዃኑ እንድሕር ተረዲእናዮ ምናልባሽ እዚ ሰብ ብኤችኣይቪ ዝተለኸበ ሰብ ተነፅሎታት ከይስምዖ ስለ ዝኽእል ብኡ ኢና ፎከስ ክንገብር ዝግባአና ብምትንካፍ ዝመፅእ ነገር ኣይኮነን ብምስዓል ዝመፅእ ኣይኮነን ብምትንፋስ ዝመፅእ ነገር ኣይኮነን ኩሉ ሻዕ ዝመፅእ በቲ ደምን ፆታ ይርክብን ስለዚ እቲ ራይሱ ከምዚ ሕጂ ፅቡቅ መወዳደሪ ኮምፔር መግበሪ ረኺብና ኣለና ካብ ኮቪድ 19 ካብ ኮቪድ 19 ዋላ ሓንቲ ርክብ የብሉን ማለት እቲ ጥንቃቄ ንወስዶ ኮቪድ 19 ዋላ ምስዓል ዋላ ምትንፋስ ዋላ ዝተከፍናዮ ነገር ምትንካፍ ዓይነት ዝሓልፍ ነገር ኣይኮነን ብቐሊሉ ዝተሓላለፍ ስታ ኣይኮነን ናይ ኤችኣይቪ ኤድስ እታ ቫይረስ ድማ ዝጉድኝ ዛቲንክ ደም እውን ከዓ ሲመን ተዘይፀንሐት ብዙሕ ኣይትፀንሕን እያ 2 ሰከንድስ እያ መስለኒ ትመውት ርግፀኛ ኮነ ክዛረበሉ ኣይክእልኒ ግን ብሓፂር ግዜ እያ ትመውት ሕጂ ናይ ኮቪድ 19 ግን ኣብ ኣየር ኮለል እንዳበለ ብዙሕ ኣፌክት ዝገብር ይኽእል ሕጂ እቲ ኣብታ ስቲግማ እንድያ ፎከስ ክበሩ ተባሂሉ ዘሎ ሎሚ ብኤችኣይቪ ኤድስ ተለኽፈ ሰብ ንሕና እንድሕር ቅድማ ብሓያ ክትፈለጥ ፀኒሓ ዘረድአቶ እቲ ማሕበረሰብ ክሳብ ክንዲ ዝተነፅሎ ዝግበረሉ ሕማም ከምዘይኮነ እቲ ሰብ ድማ እቲ ተተሓዘ ሰብ ድማ ንነዊሕ ግዜ ሙሉእ ላይፍ ኣካይዱ ክኸይድ ይኽእል እዩ ዋላ እቲ እቲ ሪሌሽንሽፕ ምስ ስድርኡ ኹን ምስ ዓሩኽቱ ኹን ዋላ ሓንቲ ኣፌክት ከይገበረ ክቕፅል ይኽእል እዩ እቲ ተነፅሎ ብዝመፅእ ግዜ ግን ሓንቲ ካብኣ ትኸፈት ነገር እንታይ እዩ እቲ ተነፅሎ ፈሪሁ እቲ ሰብ ኤችኣይቪ ፖዘቲቭ ከም ዘይኮነ ክሓብእ ይኽእል እዩ እዚ ሞር ዳሜጅ ክገብር ይኽእል እዩ ማለት እዩ ድሕሪ ሓቢእዎ ናብ ካልእ ሽግርን ከምፅእ ስለ ዝኽእል ብይና ክንጥቀቕ ዘለና ሕጂ ስግማት ምናዳ በቲ ዝመፃሉ ምክንያት ብዘይ ፍልጠት እዩ እቲ ፍልጠት እቲ ዋላ መፅሓፍቲ ዝኾነ ቦታ ካብ 80ታት ዝጀመረ ሕማም 1980s ጀሚሩ እዩ ዝመፅእ ሕማም ሕጂ ብዙሕ ተስተምህሮ ኣበቦቱ ክህልወና ስለ ዝኽእል ኣብ ብዙሕ ቦታ ክንግብር ካብኡ ዳሲስና እውን ዝበለፀ መረዳእታ እውን ክንሕዝ ስለ ንኽእል ብኡ ክንጥቀም ንኽእል ኢና ኢለ ይብል ኣለኹ የቐኒለይ ቴንኪዩ ፍቃድ ዘቕሩ
Thank you so much, Mr. Samuel Teklaab. Very short and brief. I can understand some of it because thank you so much. You've been diligently serving your community through radio service as well as church service and community service. There is a lot of service in Eritrean community. I would like to say thank you so much for all the communities. And for you, for your diligent service, for you and for Ruth. Ruth, he's with us today.
Yeah, thank you.
Not actually presenting, but she's here with us. Nice to have you, Ruth, here. We will go to our last presentation with Mr. Abdullah Sheikh from African Community Service. The time is yours, Mr. Abdullah. Go ahead.
Okay. It was great to hear the voice of different people. Some of them I understood, especially Swahili and Somali. Dr. Harare Osman was very powerful for those who don't understand. I also appreciate Tawabich Abere. Basically, there are many times I want to learn Amharic, but I was really inspired this time more because of the powerful speech. Even when I didn't understand much of Amharic. Well, my involvement as far as HIV is concerned is long. In the years that defined my early career back in Africa, I have seen someone who was admitted to one of the local hospitals back in Africa, and more precisely in Kenya. And in that small town, it must have been either late 80s or early 90s. Once people understood that someone was admitted with possible diagnosis of AIDS, everybody in town came to watch this beautiful little girl who was a young adult admitted to the hospital where I was working. And it was really terrible to watch her just being watched like an animal in a zoo. That has been one of the defining moments for me as far as HIV AIDS is concerned. It was the first time I saw the nakedness of, being exposed to people who are being discriminated. Over the years, I have come a long way also, mainly when you're an African, a male chauvinist, a Muslim, and probably a Somali, and the stigma is very high. I will say that I've come a long way. Well, some of us have been either lucky or unlucky, but we also saw other dreadful diseases like leprosy, smallpox that have been discriminated over the years in the 70s. The difference between leprosy and smallpox and HIV was that there was physical disfigurement as far as leprosy and smallpox was concerned. The UN report says that there has been about 1.7 million persons who were infected last year, and over 690,000 have died. Most of these people or persons who have died are people who are said to have a higher risk, but everybody has a risk. With this pandemic of COVID, we have had an increased discrimination. As we all know, stigma has a long, it has a long barrier to care. People who face stigma and discrimination do not come out very openly because they fear discrimination, and this has necessitated a lot of people not to come out. At the start of the pandemic, we can remember that pandemic, as far as COVID-19 is concerned, we have had significant stigma, and the stigma has been more on people who are already facing stigma. People who have HIV, who have pre-existing conditions, people who are faced with domestic abuse, people who are racially discriminated, who are sexually, whose sexual orientation is different from us. These people have already been facing a lot of discrimination, and COVID has made it more. We can all remember the years when HIV came around. It was largely associated with gay man's disease as a gay man disease, or gay-related immune deficiency, GRID, what we call GRID. But over the years, I will say that we have come a long way, and that even in Minnesota or the US, and more precisely Minnesota, the past 16 years, in 2004, when a coalition of organizations and individuals from the African Born formed AWAD, African World AIDS Day Committee. Sub-Saharan has been very focal and has been one of the pioneers of the original committees that came up. We've come a long way, but still, again, I will say that we need to identify the drivers of stigma. The drivers of stigma is biases, prejudice, discrimination, ignorance, arrogance, and these are things that we really need to fight. When we see people who are discriminating others, we should fight them at all levels, at individual levels, interpersonal level, at community level, and also at the institutional levels. Policies that discriminate people who are not only having HIV or AIDS, but also people who have autism. In recent times, we have seen a lot of resurgence of autism in the African community, and more specifically in the Somali communities, and people are again shunned. I think what we need to do is we need to put all our efforts together to ensure that people who are stigmatizing others and discriminating have the necessary information. Much of the times is because of discrimination. This discrimination is coming as a result of ignorance. In my conclusion, I will still say that I'm very impressed to know that the technology we have had over the time, the successful treatment we have had, the tests we have had in HIV world, even in spite of PrEP, the HIV pre-exposure prophylactic, which assures us that if properly taken, assures that you will have 100% prevention, we still have stigma. So I will urge everybody who is part of this team and who is not part of this team, and everybody who is listening to this, that we need to shun the old, barbaric, outdated, stigmatizing people who have HIV, who have diabetes, who have hypertension, who have syphilis, who have autism. I mean, there's no place as far as stigma and discrimination is concerned in the present world. I wish everybody well, and that's all I want to say for now.
Thank you so much, Mr. Abdullah Sheikh. Thank you for going beyond stigma and bring some very pertinent ideas and informations and solutions as well. Thank you so much. We appreciate your long year service on these issues, and then you continue to do for your community. We wish you good health, good life, to just continue to serve your community. So as far as stigma is concerned, we are now finished our presentation, but want to make some few remarks. As far as stigma is concerned, I did my thesis, my graduate school thesis on stigma, HIV stigma at a religious organization. Stigma is everywhere, especially in religious organization. Whatever they believe in different religious organizations, the stigma is there. When we say stigma can be, people can self-stigmatize themselves, internalized stigma. They can do that because if somebody is HIV positive, the doctor told them they are positive, they want to hide, they want to do a lot of things. As Tawabich already said, it's not going to help. To live a long life and healthy life, people has to expose themselves to the medical and not to people. I'm not saying everybody has to come out and speak, but they have to attend their medications, stick with doctors, with their primary doctors. The other thing is there is a governmental stigma where there is sometimes, not in case of United States, there is a travel ban for those who are HIV positive. At the same time, less resource allocation for people who are affected by HIV/AIDS. The other thing is there is a healthcare stigma where the system stigmatizes them as a pre-existing condition. There is a lot of things happening there. There is stigma everywhere. As Tawabich already said, there is stigma around employment. There are people who are refused to work, who are denied to work. So that all stigma is around. The other thing is social. Those people who are living with HIV/AIDS has to involve in every social aspect, in every social services. There is nothing they cannot do. So as Tawabich said, she said, by ignoring those people, by discriminating those people, pushing away those people, looking those people as second-class citizen, we're not gonna do something good. In order to fight HIV/AIDS, we have to come together, discuss, and then talk about the disease. It is a disease. Every disease is bad, no good disease. But we have to talk together. We have to learn from those people like Tawabich who come out and they speak their experience and then try to save people. They are living beyond what they have to. So we have to learn from those people. And then I hope next year we'll celebrate African World AIDS Day in person because COVID-19 is gonna go anyways. I wish that gonna happen. At last, I would like to say thank you so much for people who are listening as Facebook Live. We will have such kind of program in the future. We hope we'll keep in touch with you. And then I would like to say thank you so much for my guests, Ms. Tawabich Abayre from our community, Dr. Osman Ahmed from East African Healthy Project, Mr. Henry Momani from Global Health Service, Mr. Samuel Taglaab from Eritrean community, Mr. Abdullah Sheikh from African Community Service, and Mr. Bahar Omar from Sub-Saharan African Youth and Family Service. Thank you so much for your service. We as a Sub-Saharan African Youth and Family Service, very proud to sponsor this event. I hope people will get a lot of advantage, a lot of benefit from our speech. We'll put that on Facebook and YouTube. People can access anytime. Thank you so much for your time. I hope we will finish our presentation on here.